Hi, my name is Ian Schwartz. I'm the Chief of Urologic Surgery here at Hennepin County Medical Center. I'm also an adjunct faculty at the University of Minnesota Department of Urology. Being that I'm not that far from residency, I'm in my 6th year out now, it's still fresh in my mind what it was like to be a resident. I know it can be a really challenging time in your life. There's a lot of expectation, a lot of work burden, a lot of hours. And I think to be able to help foster young men and women through that is really exciting. It's a way for myself to give back to the urologic community. It's invigorating to work with residents. They actually help me. They help keep me up to speed on any new changes in the field. It's important to be able to teach residents. I think it's a rewarding aspect of my career, in addition to taking care of patients. So the culture of the department is awesome. I think you can ask any faculty, any resident here, and they'll tell you the same thing. It's one of the reasons that I chose to do residency here. When I came and interviewed, it was just the sense of warmth within the department. Everyone's very friendly, they're very supportive. And that to me was very important, especially during my training. So coming from residency here, I obviously knew what the culture was like, and that was one of the reasons why I decided to stay here. So why did I become a urologist? Urology is one of those fields where I think you strike a good work-life balance. You get an opportunity to tailor your practice from anything to the large cancer cases down to the smaller procedures. So there's a wide breadth that urology offers, and that was really attractive to me. Every department is going to be able to train residents to satisfaction. The thing that stands out to me about the department is the other people, the colleagues you work with. You know, starting out as a new faculty, the ability to have a partner come in and scrub in the middle of the night with you on a case that you're not sure about. You know, just the support, especially when you're coming out of residency, is great here. It was very important. I think it's unique too. Not all urology practices have that, and I think it's really important. The Twin Cities are a great place to live. I've lived in a few different metropolitan areas, and by far Minneapolis, St. Paul is the best I've lived in. Very affordable, you know, the people are great, and the weather's not as bad as people think it is, really, if you live here. Why should patients seek their care here? This department provides a wide breadth of coverage. The people are great. I've sent my own family members here. I've sent my own family members to colleagues here because I know they're gonna get well taken care of. And that right there is why patients should seek their care here. My clinical interests are mainly general urology. I do a lot of kidney stone disease. I also do a lot of robotic and minimally invasive surgeries, oncology, pyeloplasties, that sort of thing. We're a level 1 trauma center, so we also see a fair amount of trauma, so that is also another one of my interests. My research interests are mainly related to trauma. I've done several projects looking at trauma within urologic organs. Given that we are a level 1 trauma center here, we have a large patient database with which to do research on, and that is a particular interest of mine.